Thanks everyone for coming to my talk. So today I'll be talking about something that's very concerning currently in the United States, Europe, and even in East and South Asia, is the rapid spread of electronic cigarette use. All of you may have seen lots of young school-going kids using vape pens, disposable vape devices. So this has got the attention of researchers as well as government institutions, but it's a new product. So I think it's a good time for us to enter and do some research on it. So today I'll be talking about the health risks and some of the challenges that are there with alternative tobacco products. But out of the alternative tobacco products, I'll be focusing on electronic cigarettes. So alternative tobacco products is a term that's generally used to describe any non-cigarette tobacco products. But e-cigarettes are specific, it's a specific type of device because it doesn't burn anything and its design allows for lots of options. So brief intro about alternative tobacco products. As you know, depending on different regions, you have the most popular tobacco product. For example, hookah is very popular now in New York and some of the cities, even in Birmingham, I see these hookah lounges coming up. There's snuff, several types of tobacco. There's cigarette-like e-cigarettes, and the typical one that we are used to on the far right. But the tobacco industry is not satisfied with it. So now they're going with heated tobacco because there was a lot of fuss about e-cigarettes. So heated tobacco products just have the tobacco and it's heated to a point where it releases VOCs. And you can see how strong their marketing strategies are. These are very complex devices in a way. Some of these connect to your phone actually. But these are kind of the new generation where you heat the product rather than use a coil. So it's the tobacco itself that's heated, giving out VOCs that can be inhaled. So we cannot forget about cigarettes. Actually, the tobacco industry and the background for this started with cigarettes. And as you know, initially it was marketed as fun, good product, but later they discovered, if you see around 1990s, they found that it really impacts your respiratory system. People were dying of cancer. So then regulations came in, FDA rules, ads were banned, and finally certain components were banned. So cigarette usage actually was on the decline. And that kind of unfortunately gave a space for newer products, which we are seeing now. So this is, I hope it's clear. So this, how my students put this together, it's a good timeline of how the new products are regulated. Sorry for the small font size, but the problem that occurred with e-cigarettes is they first didn't know who should regulate it. Then it's a new product and nicotine was in a different form. So they call it artificial nicotine. So how do you regulate artificial nicotine, which is basically nicotine titrated with benzoic acid? But recently, as you know, it was in the news, the FDA banned the aggressive marketing of Juul to young people. So there is some developments, but the product is evolving so fast that regulation is finding it hard to catch up. But some other countries have actually banned the use of e-cigarettes. So amongst many alternative tobacco products, e-cigarettes is probably the most popular. About 13 to 16 million current users in the US. But the most concerning thing is the rapid rise among teens. And it's the fastest growing tobacco product among teens right now. Then it's followed by hookah water pipes, cigarettes, and so on, cigarillos. And now, like I said, the heat not burn cigarette, which is the heated tobacco product. So what is an electronic cigarette? It was actually developed in 2003 by somebody who had a father who was a heavy smoker. So he wanted to develop a nicotine delivery device. So it's basically a liquid that's heated using a coil, and that way is inhaled. So if you look at the picture, you'll see a battery. You need a battery to power it. And then there are some where you have a button to press, but these are now activated by the pull. So you have a draw, it automatically activates it. This coil heats this liquid, and then a vapor is released. So there is no combustion, but there is boiling, or like it heats up to a point where the liquid turns into vapor. So the thing about this design is now you can add so many things to this liquid. That makes it very unique in terms of the tobacco product. And that also leads to the appeal for it. So there are several types of e-cigarettes in the market right now. The initial ones mimicked a regular cigarette. Then they kept developing. They went to tank type systems, which means you can have a refillable tank almost. I'll describe sub-ohms a little later, but one of the market changes and I would say one of the most dangerous products is Juul. They invented this product where nicotine was titrated and nicotine was in salt format. So you can actually get a higher dose. And they developed this thing that looks like a USB stick. So I remember when I was in New York, it was spreading in schools and teachers thought the kids were bringing USB sticks. And just, why are you putting a USB stick in the mouth, you know? So they would do it in libraries. I had to complain once. I was trying to do my statistical analysis of my PhD, and people were vaping in the library. But then there was no rule. But finally, the school decided, and they had a sign saying vaping or e-cigarettes are also banned. So Juul really changed the game. And right now, I think there's an order to stop marketing, but they're still able to sell in the US. So this is a different description by the CDC. As you can see, the tank type devices. So these can hold more liquid. They actually have passwords in some. So it's only the user can have it. But these are the most popular ones right now. The rechargeable e-cigarettes are the disposable ones. So they use it and just throw it, or you can even buy a pod where you can fix it. I think we have the ultimate e-cigarette right now. This is an actual product that's marketed. So it's Bluetooth compatible. It can play music, you can answer your phone with it, and it connects to your phone, and it has all these apps. It's kind of amusing to somebody of my age, but actually, who's the target group? So they're targeting teens and young adults. This is very attractive to somebody who can buy it. If you go to their website, the description is really good, great graphics with the phones. You can actually time your dosage and things like that with it. You can look at your usage pattern. The concerning thing is the target group, which are young adults who are prone to addiction. And this is some of the data from 2018. As you can see, cigarettes are on the decline, which is kind of good news. But e-cigarettes were around 20%. And then you had hookah around 4%. But look at 2019. So e-cigarettes have gone up again. So prevalence for e-cigarettes are going up among high school students. And right now, I think there's about 2 to 4 million just from the surveys, but they assume that it's underreported because the survey was done during COVID. So the 2022 data will be interesting to look at. But the problem is the offsets, as you can see, cigarette smoking is going further down. But that benefit is now probably being removed by the increase in use of e-cigarettes. And how creative of CDC to use the same colors. So as you can see, e-cigarettes, again, this one is on the rise among high school students. So again, problem is they're capturing a young audience, and these are students who have not used any tobacco product before. That's the scary part. It's an entry product. So FDA finally came in 2016. There was a rule banning so many things like vape shop. You can't vape inside vape shops, like a hookah lounge. You can't. I remember there used to be vaporiums. I don't know if anybody remembers. In New York City, it was very popular. You can't really see who is inside. You have to go in, and then people are seated. They just keep trying different flavors. But right now, in 2019, there was a rule where even in Alabama, it's the same. You can sell only to people who are 21 years or older. So there are some regulations coming in, but it's still difficult to regulate. So these are some of the statistics from 2016, actually. As you can see, Alabama. The problem with some of the southern states is they have historically high rates of smoking. So it's possible that that population is now switching to vaping. As you can see, Alabama, Georgia, even New York, there's about 4 to 5% vaping right now. And most probably underestimated. So what are the thing about e-cigarettes is, since there is no combustion, there's general consensus that they emit less toxic components than cigarette smoke, because you're heating a liquid and not burning it. So they have a different profile, which we currently assume to be less toxic and lower levels of carcinogens in general. So you don't have the occupational component, and also the problem with it is also there's very limited information on secondhand smoke. So the safety of e-cigarettes is still being researched, and it's become a controversial smoking cessation tool. So like I said earlier, it was marketed as a smoking cessation tool. But the problem now is, instead of going for cessation, there are new people taking it up. So it's a little bit difficult to regulate in some cases. Like I said, there's no evidence to show that it's a good smoking cessation tool, but from the toxicological studies, you can see that there are fewer toxins if someone switches. And there's dual use also right now. So people who take up e-cigarettes are probably prone to going to cigarettes because they're so used to the nicotine and taking up newer tobacco products. And also the pod type devices, these are the most concerning ones. They're small, and to deliver a high dose of nicotine, they've been titrated with benzoic acid, so it can release aromatic compounds when it's heated by the coil. And the design allows manufacturers to add various compounds. As you can see, there's a vape shop right on at 5 points. There's THC, CBD oils. So this design allows you to add more things. And I'll explain later how these flavorings can be attractive to young people. And also during pregnancy, it's a particularly susceptible product to use because of the certain cravings and certain smells, effects of smells. These flavorings play a big role there. The other important thing is, they say it's FDA approved. You look at the flavorings in e-cigarettes, they'll say FDA approved. But that's very misleading, because that flavor is approved for oral consumption. It's a flavoring, it's a food flavoring. And they use its food flavorings, but it's not meant to be inhaled. Inhalation toxicity is different from ingestion. As I keep telling my students in the class, ingestion, inhalation, they're different. The systems, the way it exposed are different. And it led to a peak issue in the United States in 2019. This was just before the COVID-19 pandemic. And what's interesting is they stopped actually taking statistics after February 2020. So I'm pretty sure there are more cases. It was on a decline. So there are about 2,800 cases of what's called the E-Valley. That's e-cigarette vaping associated lung injury. So there were serious cases of lung injury in young adults who had no other health issues, and about 68 confirmed deaths just because of this product. I'm pretty sure it's more than that because they stopped getting statistics after that. What they suspected was vitamin E acetate, which was added to certain e-cigarettes, caused this due to the heating. And some say that because there were no regulations, certain toxic compounds may have gotten to the liquid, because at one time they were just importing things. So these toxic compounds may have caused this E-value. And there are unknown liquids and flavorings. So these are some of the statistics, as you can see. There are actually about, I think, 10 to 12 deaths in Alabama also. JCDH has the records. I tried to get the records to do follow-up studies, but unfortunately it was not possible. But most of these people, what they experience is decreased lung function, your linings, and you have cell toxicity in the lungs. So they're pretty much scarred for life. Once your lungs have damage, it's very difficult to repair, depending on the damage, of course. But most of these patients, from what I've heard from the recent studies and reports, is they don't recover as fast. They have decrements in lung function and lots of inflammation and so on. And as you can see, the THC containing products that were the main cause. So that's why they assume it's probably vitamin E acetate. So what's in e-cigarette aerosols? Well, it depends on what's in the e-liquid. So the liquid that they use is mainly vegetable glycerin or propylene glycol. So it's an organic solution, meaning carbon-based. So this vape juice, as they would call it, contains certain VOCs, flavorings, like I said, nicotine in most cases. There are non-nicotine vape products, but they're not very popular. And also any other flavorings that they feel like adding. Unfortunately, it's not regulated. So like I said, nicotine, and once you release it, the aerosol can contain fine particles, which can go deeper into the lung. And as you know, diacetyl, we've heard about the popcorn lung. So they use it as a flavoring product. So you can have lots of this in e-cigarettes and sometimes heavy metals also. So these are some of the studies that have shown these compounds. As you can see, carbonyl compounds. These are known to be toxic to the cardiovascular system, polycyclic aromatic hydrocarbons, heavy metals, and some of the other diacetyl and so on. So these are known toxic chemicals, but their effects, physiological effects, are still being studied. So this is an interesting study that looked at exposure biomarkers. As you know, once you're exposed to a certain chemical, your body produces exposure biomarkers. And compared to cigarettes, if you see most of the graphs, compared to cigarettes, it's lower. E-cigarettes is the third one. It's generally lower, but compared to never smokers or never users, it can be high, especially for things like pyrene, lead, nicotine, also acrolein. So things like these are known carcinogens as well. So compared to a non-smoker, it's higher. But unfortunately, the tobacco industry has used this in their studies. If you look at early e-cigarette studies, they were sponsored by the tobacco industry. It was funny to go to the Society of Toxicology conference and see a poster from Philip Morris on the toxicity of e-cigarettes. And it's, comparatively better is what they say. But I think even the NIH had the report come out that said, no, we need to look at it objectively. Because comparatively, yes, it may be better. But compared to non-users, you're getting exposed to high levels. And this I used to show, I want to use this to show how increased levels have been. So the PATH study is a huge, it's a national study that collects data on tobacco product use. Actually, I was in discussion with Dr. Rowan soon to try to analyze exposure biomarkers in the fourth wave of this study, because they had collected more biomarkers. But as you can see, NVs are nicotine vapors. In all of these, the concentrations increase in each wave, the NV line. So that means there's more use, probably, more products being added, and the exposures are increasing in the population as more data come in. So the compounds that are released also depend on the heating coils properties. So these are two pictures of the heating coils. As you can see, with use, things build on it, and they then change the compounds that are released. So these are really gunked up. And e-cigarettes also allow to adjust the voltage and the power properties. So that's called a sub-ohm vaping device. They change the resistance of the coils to produce this thick vape, as you can see. And they have like contests on us. Like, it's crazy. It's like the cloud that you can release. So these are devices that adjust the coil properties to produce a higher power, low resistance, and then a higher cloud. So it's unbelievable how much they're taking in. This is a study that was done when I was at NYU. They developed an e-cigarette machine. As you can see, when it's at 5.1 volts versus 2.5 volts, the vape component is higher. And we use these to expose cells and found that, like as you can see, when you increase operating voltage, formaldehyde, these carbonyl compounds increase. So these are known carcinogens, and the increase of these, you can assume, will have potential adverse effects, especially in young people. So what are the health effects that they've already found? So most of the studies currently that have been done with cell lines, air-lung epithelial cells. So in vitro, it decreases viability, oxidative stress, barrier disruption, and signaling changes. In vivo, inflammation is a big thing. So they found that lots of airway inflammation occurs in those who use e-cigarettes. And bronchitis, symptoms such as increased airway resistance and oxidative stress have been reported in research studies. But again, it's challenging because, like I said, certain metrics that were developed for smoking. So we are looking at this in that angle. So there may be a chance that we might miss things. But still, most studies have shown that it affects the respiratory system. There can be impacts on the cardiovascular system, but I think there's still data coming in. But in the respiratory system, there's decreased lung function. In some studies, it's mixed, and I'll explain it in a little bit. You have airway hyperreactivity, increased airway resistance, and also the dangerous thing is that it can affect the small airways and the alveoli. So this is a study they did in 2000. I mean, this is a compilation in 2017. And if you look at the 2022 one, you see more research being done and more being added to each of these components. So there's research coming in showing that alveolar edema produce surfactant protein. So more research is showing that there are more serious effects on the lung. And this is a study that was recently published. So vaping behavior can also impact how these cytokines are expressed. So this is nasal cytokines. There's a study that compared nasal cytokines to salivary cytokines. And what they found was in vaping, it's called retrohaling, I think it's called. So in cigarettes, you would inhale through your mouth and exhale through your mouth usually. In vaping, they inhale through their mouth and exhale through their nose. So the regions where it can affect are different. So as you can see, NS is non-smokers, CS cigarette smokers, H acetate hookah, and EV or EV is e-cigarette users. As you can see, compared to controls, you have higher expression of nasal cytokines. And these are pro-inflammatory cytokines, meaning there is inflammation in these systems. So this is a study that they did to try to identify how people vape. So it was interesting. They used to go to intersections and watch people vape, and they recorded the vaping behavior of 100 people. So like most people would exhale from their nose rather than their mouth. And that has a different effect and different expression of nasal cytokines. It can impact air quality as well. As you can see, this is a study I was also involved with when I was NYU. We compared different products in homes. We went to homes and actually set up monitors and asked them to vape in the primary home. So a primary room was like their living room. And the secondary room is where one of their children or somebody would be there. So you want to see if it would spread to the secondary room. The good thing is in most cases, it did not. But as you can see in e-cigarettes, it stays. The vape stays. If you look at pre-exposure, post, meaning after use. So after use, it's still at a high level. So the aerosol kind of stays in the environment. The dilution is low. So if you use it in homes, there's a high chance that the kids and others can be exposed to e-cigarette vape. And this is carbon monoxide. As you can imagine, for hookah, it keeps increasing because they leave the coal on top. So it's a combustion product. But for e-cigarettes, you don't get CO, carbon monoxide, but you definitely get EN and other compounds. VOCs for sure, but we couldn't measure them. So studies at UAB, and these are the studies that I'm involved with. I'm happy to see that we have collaborations. And right now, we just published this paper. We looked at vaping among UAB students. So we surveyed We had flyers where people use a qualitative survey in their phone. So this is the data from 408 UAB students aged 18 to 24. And we have about 15.6% of our students using e-cigarettes. And again, that's probably an underestimate. I think it's probably higher. So these are our UAB students, 15.6%. And the interesting thing that we found was that there was difference in the primary vaping device between sexes. So as you can see, females use more of the disposable vaping products, whereas males use more of the tank and mod type device. And this was 5 times. It's statistically significant. What this shows is the marketing strategies. There are aggressive marketing strategies to get new populations to try new products. Because tanks and mods are usually used by people who have been using e-cigarettes for a long time. So it's concerning that amongst females, disposable cigarette use has increased a lot, because that means the marketing strategies are targeting these new entry, smaller products to different populations. This study is ongoing, by the way. We have lots of other data coming in. Like, for example, most students started below 18 years, which is not surprising. And then friends were the most influencing factor. There are about 2% who a professional had actually recommended them to switch to cigarettes. But what this shows is that it's not a cessation tool anymore. It's just an addictive product that people use because of either friends or peer pressure or just curiosity also. There are other collaborations. I'm doing a study with Dr. Peter Hendricks. Actually, we submitted a grant. It's not really favorably got scored, but still discussed and scored. But I think we need some improvements there. We want to see, because we have a big population now in the US of people who have been vaping for a long time. So what happens once they stop vaping? We still don't know. We know the benefits of smoking cessation, but we don't know if vaping will have any, cessation from vaping will have any benefits. And like I said, I'm also interested in looking at biomarkers in the newest wave of the PATH study with Dr. Royan. And this, I think, the one I'm most interested in is to look at the impacts of e-cigarette use during pregnancy. Collaborating with Drs. Rachel Sinki and Akira Subramaniam at the CWR. We actually submitted an R01 last year. Again, discussed and scored, but some of the comments were very unfair, I thought. So hoping to resubmit that. Once it gets funded, I think it would be a good study to look at the risks of vaping during pregnancy. And we are focusing on biomarkers of exposure, inflammatory biomarkers, and birth outcomes. It will be like an inclusive study of all of these. I'm also using my Harvard Fellowship funding for this. So we'll get some preliminary data, which I'm hoping to start around June, July this year. It's concerning, and I'm very interested in it because vaping during pregnancy is on the rise. There's about 7 to 8% that they have found. And flavorings are kind of more attractive during that period. So a study had found that, for example, sweet flavors, menthol flavors are particularly attractive during that time, and they found that those are the highest flavorings that are used during pregnancy. And the impact on the fetus, the growing fetus. So part of our study proposed to look at cord blood, biomarkers of exposure and inflammatory biomarkers in cord blood, which will give us some indication if there is transfer of these compounds or not. So fingers crossed if it gets funded, hopefully. But let's look at some of the challenges, and I mentioned some of these earlier. The problem with e-cigarettes is even during pregnancy or even look at lung function, is it's a very fast evolving product. So one of the comments that the reviewers had asked was, how are you going to look at changes in usage over time? What about the different e-cigarette types? And what are they using? So some of the preliminary data will probably help address those questions. And there's no limit to additives that they can have in the e-cigarette. So this actually literally has led to thousands of combinations of flavors. And each of these combinations will produce a different exposure profile, which will lead to a different inflammatory biomarker profile. So it's challenging because of that to also have regulation. What flavors will be banned? Tobacco flavors are already banned, actually. Tobacco is banned, but sweet flavors, THC, some of those actually are marketed as healthy products. CBD oils, oh, it will relax you and all that. So there's a big challenge there in trying to identify what to ban as well. And also the other problem is the metrics that we use now are focused on regular cigarettes. And we apply those to e-cigarettes and say, okay, it's better than cigarettes. But what about if you look at it objectively using other methods? Then there's aggressive marketing. I mentioned this earlier. And then regulations and who has the authority also has been a bit of a debate in recent times. So what's the final message? Yes, it is true that there are lower levels of emissions compared to combustible cigarettes. That's for now. But there are effects on the lungs, especially inflammation and airway restriction, and possibly other organs. It can be a decent approach to smoking cessation. If someone's a heavy smoker, yes, probably an e-cigarette can help. But there's also addictive potential for kids and young adults. I think this is the biggest concern, is addictive potential and later use of other tobacco products. Once they get into e-cigarettes, there are lots of studies that have shown that later in life, they tend to go into regular cigarettes. Then they become dual users and so on. So finally, what I can say is it's safer, but not safe. So we need to have some regulation or actually educate the young people. There's a joke like in New York, it's very rampant. You'd see there was a bus stop across our office, and we would see kids coming in and just after school using these vape products. And we try to do a study in schools, and the school bathrooms are where they use most of the products. We used to have a joke saying, what are people doing in the jewel room? And we tried to measure it, but they destroyed our pumps and measuring devices. They had taken the nicotine sensor and put it in the toilet. So it's not easy to do some of these studies. But I still think that as a university, we should also look at our students, because most of our students, like in our study, they're using these products. And I actually talked to Maria White also to try and see if we can have a program or some information sessions for students about the risks of vaping this time.